Done.
Hey, what's wrong with you, Ain? Are you okay? Why are you so sweating?
I don't know. It just suddenly I feel.
I think I need to bring you to the hospital now. Let's go.
Come in. Okay, so how old are you?
I'm 21 years old.
21. So why you came here?
Just now I realized that she sweat a lot, and lately her face always look pale.
Other than that, what another any sign that you can see from your daughter?
I always have headache and my hand shake a lot.
Share a lot. So I think I have to take your blood pressure first in order to know what is the cause of your disease. Okay, from the blood pressure test just now, I found out that your daughter had a high blood pressure. Because she is still young, I think this is a young hypertension. But I can prove it yet. So I think you have to do urine test first. After that, we call you later and tell the result. Is it okay?
Okay.
Okay, thank you.
Thank you, doctor.
Wow, I think she had a very high blood pressure, 160. This is not normal anymore. So, her urine test also show that her epinephrine and norepinephrine also high in her blood. So, I think she had a pheochromocytoma. Maybe I need to prescribe her with phenoxybenzamine. Oh, phenoxybenzamine. I think I remember something. Hi everyone. Have you finished the task that I given to you? If everyone have finished it, so we're gonna to present it now.
Discovery of phenoxybenzamine in 1976. Phenoxybenzamine was the first alpha blocker that to be effective for treatment of BPH, benign prostatic hyperplasia. And 2 years later, the therapeutic benefit for phenoxybenzamine was confirmed by a randomized placebo-controlled study. However, at the same time, they also find out that if the phenoxybenzamine was used at high dose, it actually can treat hypertension. So that's why we can use phenoxybenzamine to treat pheochromocytoma.
This is the structure of phenoxybenzamine. It is a haloalkylamine. You can see here this is halogen, alkyl and amine. Okay, it is basically a non-selective alpha adrenergic blocking agent. It can bind to both alpha 1 and alpha 2 receptor. But it has affinity to alpha 1 receptor. So the first one, it will bind to the binding site by weak ionic bond and then hydrogen bond. But this stage is referred to as non-equilibrium blockade. So after that, it will bind with a strong covalent bond. Because of that, the effect of the drug will be prolonged to the patient.
Okay. Are you guys wonder about the mechanism of action of phenoxybenzamine?
Yes.
Okay. I have prepared an animation about that mechanism. So, let us see the video. When alpha agonists such as norepinephrine and clonidine bind to the alpha receptor, full activation of the receptor will be produced. However, phenoxybenzamine is an alpha receptor antagonist. Thus, it produces its therapeutic actions by blocking the alpha receptor to prevent the activation of the receptor. When the full agonists bind to the alpha receptor, the receptor will be in an active state and some effects will be produced. In contrast, when the phenoxybenzamine blocks the alpha receptor, it will keep the norepinephrine from tightening the muscles in the walls of smaller arteries and veins, which cause the vessels to remain open and relaxed. This widening of the blood vessels will improve the blood flow and lowers the blood pressure. Any question?
Oh, I have. How about the pharmacokinetic of the phenoxybenzamine occur?
Okay. For the pharmacokinetic of the phenoxybenzamine, phenoxybenzamine is effectively administered by all routes, but injection should be given only by intravenously because of their irritant properties. After the drug is injected, a delay of a few hours occurs before a blockade develops because the molecules must undergo biotransformation into an active form. Okay. For the absorption of the phenoxybenzamine, approximately 30% of orally administered phenoxybenzamine appears to be absorbed in active form, and basically absorption for the intestine is incomplete and somewhat unreliable. Next, the distribution of phenoxybenzamine. Phenoxybenzamine is distributed to the fatty tissue and slowly released. However, a stable bonding to tissue constituents rather than slow release from fat is responsible for the prolonged action. And basically, phenoxybenzamine is metabolized in liver and mainly excreted in urine and also can be excreted in bile. The half-life of phenoxybenzamine is 24 hours because the phenoxybenzamine, the blockade by phenoxybenzamine is irreversible and non-competitive. So the only mechanism the body has to overcome the block is to synthesize a new adrenal receptors, which requires a day or more. Okay, that's all from me.
Okay, today I will present to you about the indication for phenoxybenzamine. So usually we use the phenoxybenzamine to treat the pheochromocytoma, which we treat the high blood pressure when they have the adrenal medulla tumor. So when the person that is suspected with the pheochromocytoma, they usually have high blood pressure, heavy sweating, headache, rapid heartbeat, and shortness of the breath. So with the drug, it will lower the blood pressure of the person that have been diagnosed with this disease. So at lower dose, we can use this drug to treat the for longer term management of bladder obstruction at lower dose. Usually, what makes this drug different from the other drug is a long-acting drug, because the other drug only short-acting. But what that means also special about this alpha blocker phenoxybenzamine, because it binds to the other side of the adrenal receptor, which make it different from the other drug. So usually people with pheochromocytoma, they came with we make them with the blood plasma test for catecholamine and metaphrine level. when they have this disease, their blood will have a higher dose of catecholamine and metformin. So we can give this drug in order to inhibit the action of the catecholamine, which cause the high blood pressure. So usually normal metformin level in the blood is about 0 to 1.7. But when the people come with the pure chromocytoma, their blood level of metformin is about 7.1 until 10.3, which is very high. So we can say that people with pure chromocytoma, they have different blood pressure over the time. That means for example, at first hour they have about 160. When they came another next hour, their blood pressure will raise into 200. So it's not like the normal hypertension, because the long stimulation of epinephrine and norepinephrine. You understand?
Yes. Okay. Back to my part is the adverse effect of phenoxybenzamine. As we know that phenoxybenzamine is an alpha-adrenergic blocker, which means that it blocks peripheral alpha-adrenergic receptor and causes vasodilatation. So, the excessive vasodilatation of this drug will cause postural hypertension and reflex tachycardia. So, how this drug lead to the postural hypotension and tachycardia is because by blocking the alpha-1 receptor, this drug will prevent vasoconstriction of peripheral blood vessel by the endogenous catecholamine, which is epinephrine, norepinephrine. Thus, it will lead to the decreasing of peripheral resistance and will provoke a reflex tachycardia and will cause the increasing of cardiac output due to the reflex of sympathetic stimulation. Phenoxybenzamine produce a potentially life-threatening effect because of this postural hypertension that is responsible for the discontinuation of the phenoxybenzamine therapy for the patient.
So, other than postural hypertension,
Yes.
does phenoxybenzamine has other adverse effect?
Yes, of course. The other effect of the phenoxybenzamine is we can see at the respiratory system, it will cause the nasal congestion. Because of this vasodilatation effect, it will increase the secretion of mucus in our nose. Besides that, it will also causes meiosis, which means that the decreasing of the pupil size. And the next patient also have a drowsiness and fatigue effect because of the cranial vasodilatation. It's because we know that phenoxybenzamine is a lipophilic agent that can cross blood-brain barrier. So it will affect our nervous system and will cause fatigue to the patient. The last side effect or adverse effect, we can see in the genitourinary, it will inhibit the ejaculation because of the decreased vasoconstriction of the vas deferens. That's all.
So, for the treatment of pheochromocytoma, there are two, phenoxybenzamine and phentolamine. But we choose phenoxybenzamine because it is an irreversible non-selective alpha-adrenergic antagonist, while phentolamine is reversible. And the phenoxybenzamine will bind longer to the receptor because it will form permanent covalent bond to the receptor. And it will also not be affected by the massive release of epinephrine and norepinephrine. So, that's why we use phenoxybenzamine to treat this pheochromocytoma.
The next patient's waiting.
Okay, thank you.